Have you taken your vitamin dose today? If so, be careful. What I'm going to reveal in this video could completely change the way you think about supplements. As a doctor specializing in senior health, I am shocked with what I discovered. A very common vitamin among elderly people can dramatically increase the risk of stroke, and worst of all, this effect can happen overnight without warning. In the United States, stroke, also known as cerebral hemorrhage, is the fifth leading cause of death. Every 40 seconds, someone suffers a stroke. Every 3 minutes, someone dies from it. But what if I told you that one of the culprits could be on your own vitamin shelf? I am the Dr. William Tharnell, a physician specializing in senior health, with over 25 years of experience in geriatrics and integrative medicine. And in this video, you'll learn which vitamin can be dangerous, why does this happen, and what you should do now to protect your mind and your life. Before we continue, please like this video, subscribe to the channel, and share it with your friends and family. This information may literally save lives. And tell us here in the comments, do you usually take vitamin supplements? Which ones do you use most often? George, 72, is retired and lives with his wife in Oregon. An active man, he walked every day, did crossword puzzles, and had never had any serious health problems. 3 months ago, he was brought to our clinic after suffering a stroke while sleeping. He didn't smoke, drink, and maintained healthy habits. But there was one detail. George took a daily vitamin supplement, recommended by a friend, who swore it was good for everything. When investigating his history, exams, and habits, we noticed something alarming. The supplement George was taking had very high doses of a vitamin that, in excess, interferes with blood clotting. What seemed harmless, just a vitamin, had become the silent factor that contributed to the stroke. This case raised an alarm for us. And what we discovered next was even more worrying. Few people know, but strokes, or CVAs, don't just happen to people with high blood pressure or uncontrolled cholesterol. They can also occur completely silently, while the person sleeps. And when that happens, the response time is much more dangerous. A stroke, or cerebrovascular accident, occurs when blood flow to a part of the brain is interrupted. This can happen for two main reasons. Obstruction of an artery, so-called ischemic stroke, which represents about 85% of cases. A rupture of a blood vessel, leading to bleeding hemorrhagic stroke. During sleep, the body naturally slows down. Blood pressure drops, breathing becomes lighter, and the metabolism goes into economy mode. But if there is an imbalance in blood clotting, caused, for example, by excess of a vitamin that interferes with this process, the risk of obstruction increases. The result? A person may have a stroke in the middle of the night and only be found with serious aftereffects in the morning. That's exactly what happened to George. His wife thought he was just more tired, but when she tried to wake him, she noticed his speech was slurred and the right side of his body was paralyzed. That's gravity. And so, understanding how our daily habits, including seemingly harmless supplements, interfere with this process is so important. The vitamin that has us most concerned when we talk about stroke is vitamin E. Yes, it is widely touted for its supposed antioxidant benefits, for fighting aging, and even protecting the heart. But what many ignore is that in high doses, it can thin the blood dangerously, especially when combined with other medications common among older adults, such as blood thinners. Vitamin E acts as a natural antioxidant, protecting cells from damage. However, it also inhibits platelet aggregation, which means that the blood has more difficulty clotting. In healthy people, this may seem like a minor detail. But in older people with more fragile veins and a higher risk of vascular injuries, this action may be necessary as a trigger for brain hemorrhages. Studies published by National Institutes of Health, NIH, have already pointed out that doses above 400 IU per day of vitamin E are associated with increased risk of hemorrhagic stroke. And the scariest thing is that many supplements sold over the counter in US pharmacies contain doses well above this limit. Furthermore, this vitamin is often combined with others in multivitamins. What seems like a small dose in one product adds up to what a person consumes in another, and then the risk silently multiplies. Therefore, the warning is clear: vitamin yes, but with guidance. And never in excess. science has raised a warning that few people are publicizing. Not every vitamin is safe in any amount, and when it comes to vitamin E, the evidence is worrying, especially for those over 60. One of the most relevant studies was published in Journal of the American Medical Association, JAMA. He accompanied more than 40,000 men over 50 years old for several years. The initial goal was to analyze the effects of vitamin E in preventing prostate cancer. But the results showed something unexpected. Men who took high doses of vitamin E had a significantly higher risk of suffering a hemorrhagic stroke. Another survey, conducted by Cochrane Database of Systematic Reviews, which gathered data from dozens of international studies, concluded that high doses of vitamin E may increase overall mortality in the elderly, especially when combined with other fat-soluble vitamins, such as vitamins A and K. What's more, a review conducted at Harvard University showed that, despite its fame, vitamin A has no proven effect on preventing heart disease or improving longevity, as many imagine. On the contrary, indiscriminate use can be more harmful than beneficial. These discoveries should be printed on the packaging. But they aren't. Therefore, it is essential that this information reaches you in a clear, direct, and responsible manner. If vitamin E poses excessive risks, why is it still included in so many supplements aimed at older people? The answer lies in a mixture of marketing, misinformation, and outdated standard soft formulation. For decades, vitamin E was promoted as a powerful antioxidant. It was believed to help fight free radicals, reduce inflammation, and prevent degenerative diseases. These claims were reinforced by advertising campaigns, popular articles, and even recommendations from professionals who weren't up to date with the latest evidence. With this, vitamin E became almost mandatory in multivitamins aimed at people over 60 years of age, and the problem has only gotten worse with the more is better culture, which is completely wrong when it comes to micronutrients. Another reason is economic. Vitamin E is cheap to produce, has commercial appeal, and also gives the product a more attractive label, as its name is associated with health, youth, and cellular protection. Unfortunately, many laboratories continue to repeat old formulas, without taking into account advances in science. The result is that millions of elderly people consume cumulative doses of vitamin E every day, without knowing that they are exposing themselves to an increased risk of brain hemorrhages, especially if they take blood thinners or aspirin. And that's precisely why we need to talk about what really differentiates a safe dose from a dangerous dose. When we talk about vitamin E, the dose makes all the difference between benefit and danger. In the United States, the limit recommended by National Institutes of Health, NIH, for adults is 15 mg per day, or equivalent to about 22 international units, IU. However, many supplements on the market contain 100, 200, and up to 400 IU per capsule, that is, 5 to almost 20 times more than necessary. And what does this mean in practice? This means that an elderly person who takes a multivitamin in the morning, an antioxidant supplement in the afternoon, and also consumes fortified foods may be exceeding their recommended daily intake. Easily 400 IU per day, a limit that, according to studies, is already associated with a higher risk of hemorrhagic stroke. Now, imagine this excess combined with other common factors after age 60, such as use of anticoagulant medications such as warfarin or aspirin, uncontrolled hypertension, fragility of cerebral vessels. The risk multiplies silently. Furthermore, many older adults believe that because it's a natural vitamin, it's okay to take high doses. But the human body doesn't work that way. Fat-soluble vitamins, like E, accumulate in the body. Excess is not easily eliminated and can lead to dangerous imbalances, especially in the circulatory system and brain. The message is simple and straightforward. More is not always better. With vitamins, safety lies in moderation and medical guidance. In doctors' offices across the country, a pattern repeats itself. Patients come in reporting feeling tired, lacking energy, having trouble concentrating, or worrying about aging. And often, instead of seeking expert guidance, they make a decision on their own, start taking supplements on their own. According to data from National Center for Health Statistics, more than 50% of adults over 60 in the United States regularly take vitamin supplements. Many believe they're doing their health a favor, and indeed, that's the intention. But what should be preventative care can turn into a hidden risk. The error is in belief that, if it's good for you, you can drink it as much as you want. The problem is that an elderly person's body does not react the same way than that of a young person. Metabolism is slower, liver and kidney function may already be compromised, and there is greater sensitivity to blood fluctuations, especially when medications are being used. And here comes a second common mistake: the unsupervised combination of multiple supplements. Many seniors take a generic multivitamin in the morning, a bone supplement in the afternoon, and something natural for memory at night, not realizing that all of these products may contain vitamin E in different concentrations. Furthermore, many people don't read labels. Or, if they do not understand the values of international units, IU, nor the impact of these doses on the body. The result? A progressive and dangerous accumulation, which goes silently thinning the blood, weakening the brain's vessels and paving the way for a possible stroke. Another point that deserves attention is the false sense of security that supplements offer. Many people believe that by taking vitamins daily, they are shielded against disease, which leads them to relax on habits that really make a difference, such as a balanced diet, exercise, and controlling blood pressure. Finally, there is the cultural factor. The supplement industry in the United States generates billions of dollars annually. There's a strong marketing push to convince the public that they need more and more products to age healthily. But real health doesn't come from a bottle. It starts with correct information, informed choices, and medical monitoring. Taking vitamins without guidance is like driving at night without headlights. You might think you're doing fine, until something serious happens and it's too late to react. The human body is wise. It often gives signs, small warnings, that something isn't right. The problem is, these signs are often too subtle or mistaken for natural aging. In the case of excess vitamin E, symptoms can appear mildly and progressively, and therefore often go ignored. But paying attention can be the difference between prevention and a medical emergency. One of the most common symptoms is bleeding. If you notice that you are having nosebleeds more often, bruising the skin with small touches or light taps, seeing blood on gums when brushing teeth, this could be an indication that the blood is too thin. And in many cases, this is linked to excess anticoagulant substances in the body, including vitamin E in high doses. Another worrying sign is the feeling dizzy or losing balance, especially when getting out of bed or changing positions. This symptom can have many causes, of course, but it can also indicate unstable cerebral blood flow, something that shouldn't be ignored. Additionally, some patients report persistent fatigue, even after a good night's sleep, unexplained muscle weakness, blurred or confused vision, which comes and goes throughout the day. These symptoms are often attributed to aging, but they can be the first signs of cerebral microbleeds or changes in neurological function. There is also the emotional aspect. Some patients develop anxiety, irritability, or episodes of mental confusion. This can occur due to changes in cerebral oxygenation or chemical imbalances caused by an excess of fat-soluble vitamins, which are not easily eliminated and can affect the central nervous system. And pay attention to an important detail: these signs often appear before a major event, such as a stroke. Ignoring them is like hearing the fire alarm and thinking it's just the microwave beeping. If you or someone in your family has these symptoms, don't wait, seek medical advice and carry a complete list of any supplements and medications you're taking. Often, the cause lies right there, in something that seems harmless, but which the body is already trying to reject. If you've noticed throughout this video that you take vitamin E, whether in capsules or as part of a multivitamin, the first thing you need to know is, don't panic. The goal here is not to generate fear, but rather awareness and responsible attitude. The first recommendation is simple: check the label of the supplement you are using. See if there is vitamin E in the composition. Look at the indicated dose. Is it in milligrams mg or international units, IU? If it is above 200 IU per day, is a warning sign. If it is above 400 UI, it is time to act with more urgency. The second step is to discontinue use immediately only if suspicious symptoms occur, such as unusual bleeding, frequent bruising, dizziness, or other signs already mentioned. If there are no symptoms, do not interrupt on your own. Instead, schedule an appointment with your doctor and take the supplement with you. Many seniors forget to mention the natural products or vitamins they use, but they have a direct impact on your health and the medications you already take. During your appointment, ask your doctor to assess the real need for the supplement, check interactions with medications you already use, especially blood thinners, reassess whether vitamin E levels can be safely obtained through diet alone. It is important to understand that in many cases, the body already gets enough just through diet, especially with a diet rich in nuts, seeds, spinach, and vegetable oils. And remember, supplementation should be done based on clinical need, not habit or fashion. What works for one person may be harmful for another, especially after age 60, when the body becomes more sensitive to any excess. If you know someone who takes a lot of supplements on their own, please share this information. Often, the good intention of taking care of yourself can turn into an invisible risk. The good news is that we don't need to resort to capsules to protect the brain. Nature already offers a series of foods that contribute to brain health, without the risks associated with excess supplements. After age 60, the brain needs the right nutrients, in the right measure, and obtaining them through food is the safest and most efficient way. Below are some of the foods with proven protective action, which can and should be part of everyday life. Fatty fish, such as salmon, sardines, and mackerel, rich in omega-3s, they help reduce brain inflammation and improve blood circulation. Including 2 servings per week is enough to reap the benefits. Dark green vegetables, such as spinach, kale, and broccoli, natural sources of antioxidants, folate, and vitamin K, all important for memory and brain vascular health. Red fruits, such as blueberries, strawberries, and raspberries, studies show that these foods help delay cognitive decline because they contain flavonoids that fight free radicals. Nuts and seeds, such as walnuts, almonds, chia, and flaxseed, they offer good fats, natural vitamin E, and minerals that promote communication between neurons. Extra virgin olive oil. It is anti-inflammatory, protects blood vessels, and is one of the bases of the famous Mediterranean diet, associated with a reduced risk of stroke. Oats and whole grains help maintain stable blood sugar levels, which also promotes good brain function and reduces the risk of strokes. The secret is in mounting balanced, colorful, and varied meals. And most importantly, let food fulfill its natural role, without relying exclusively on bottles and capsules. By eating right, you give your body what it needs, without the risk of excess, without overloading the liver, and with real and lasting benefits for the mind and heart. Many older adults are afraid to talk to their doctors about taking vitamins and supplements. Some think they will be judged, others believe that it is not important to mention what they buy at the pharmacy or online. But the truth is, this conversation could save your life. One of the biggest mistakes is to think that supplements are natural and therefore do not interfere with treatments. However, any substance you consume frequently, including vitamins, can impact your tests, your symptoms, and the medications you take. So, take this guidance seriously. Bring an updated list of everything you are taking to each appointment. Include vitamin supplements, natural or herbal products, prescription medications, and even that tea you drink every night. Don't be ashamed. Good doctors don't judge. They need all the information to care for you safely. If you are taking vitamin E, is this vitamin really necessary for me? Is the dose I am taking safe, considering my age and medications? Can I substitute with natural foods? These simple questions open the door to a frank conversation. And above all, they show your doctor that you are active in your own care, and not just waiting for others to decide for you. If you feel unsure about talking, take someone you trust with you. A child, a grandchild, a friend. But remember, you have the right and the duty to participate in decisions about your health. The good news is that you have more control over your brain health than you think. Research shows that with some simple changes to your daily routine, you can reduce your risk of stroke by up to 40%, even after 60 years. These changes do not require great sacrifices. They depend only on attention, discipline, and small consistent choices. See the most important ones. 1. Strict control of blood pressure. Hypertension is the main risk factor for stroke. Check your blood pressure regularly at home, avoid excess salt, and strictly follow your doctor's instructions. If it is above 140/90 frequently, seek help immediately. 2. Regular walks, even if light. Physical activity improves circulation, regulates blood sugar, and strengthens the heart. Walking 30 minutes a day, 5 times a week, is enough to significantly reduce the risk of stroke. 3. Diet based on real foods. Avoid ultra-processed products and those rich in trans fat, refined sugar, and sodium. Prioritize fruits, vegetables, legumes, whole grains, nuts, and olive oil. These foods provide the right nutrients without the risks of excess. 4. Blood sugar and cholesterol control. Maintaining balanced levels reduces the risk of plaque formation in the arteries, which can lead to ischemic stroke. Have regular checkups and, if necessary, use medication under medical supervision. 5. Sleep well and avoid chronic stress. Restful sleep helps the brain regenerate. Constant stress keeps the body on high alert, raising blood pressure and damaging blood vessels. Practices such as meditation, reading, and leisure time play an essential role in prevention. 6. Quit smoking and avoid excessive alcohol consumption. Smoking directly damages blood vessels. Alcohol in large quantities also increases blood pressure and alters clotting. Eliminating these habits is one of the most impactful decisions for your health. These changes, when made consciously, reorganize your body to protect itself, instead of relying on excessive supplements or emergency interventions. You can start with one, and then add another. The important thing is to take the first step and move forward. After so much information, you might be wondering, have I already done something wrong? Is there still time to change? The answer is clear. Yes, there is time. There always is. Your brain health isn't set in stone. It is shaped by your daily decisions, what you eat, how you move, the thoughts you entertain, and yes, even the supplements you decide or don't take. The most important thing is to understand that you are not at the mercy of age. Being 60, 70, or 80 doesn't mean everything is out of your control. On the contrary, now is the time to act more consciously than ever. Because every step you take, in the right direction, has a real impact on your memory, your autonomy, and your quality of life. Avoiding excess vitamin E is just one piece of the puzzle. By paying close attention to everything you consume, talking clearly with your doctor, and adopting habits that promote your well-being, you send a powerful message to your body. I'm here for me. And your body responds. Every day you choose to take care of yourself with balance and information, your mind will thank you, your brain health will be strengthened, and the risk of serious illnesses will decrease. The truth is simple. There is no magic pill, but there is a path. And it starts with you. If you've made it this far, congratulations. It shows you're committed to your health, and more than that, to your life. Today you learned that not every vitamin is harmless, and that even something as common as vitamin E can pose a risk, especially when consumed in excess or without guidance. But you also saw that there are safe alternatives, that the right diet protects your brain, and that small changes can bring big results. You understood that the secret is not in more products, and yes, in more awareness, more attention, and more balance. If you haven't checked the labels on your supplements, do it today. Write down the doses, check the ingredients, and schedule a consultation with your doctor. Take this information with you. It can make all the difference. And if this content made sense to you, share this video with other seniors, family members, and loved ones. This is the kind of knowledge that saves lives, and that should be in everyone's hands. I am the Dr. William Tharnell. It was an honor to accompany you this far. See you in the next video. And until then, take care of yourself, because no one else can live your life for you.